one of your keys to be looking for the front of a heart is notice where your pulmonary trunk is. Okay? The pulmonary trunk is, in my opinion, is your giveaway that I'm looking at the front of the heart. Okay, so we know this is the front. This heart would sit is just like this. It's pretty close to what your heart size would be. So it would sit just like this in your chest because it has left axial deviation. Okay, with the posterior rotation is going to rotate this way, and that's how it would sit in the chest. So it doesn't sit straight up and down; it's angled. Okay, so looking at these key structures here, you're going to see. If you use your imagination, there's an imaginary line that comes down. I'm drawing a sulcus here in the fat layer. Because this fat layer, this would, right here, what I'm pulling off would be your visceral pericardium. The pericardial sac would be this material here hanging. So that would be your parietal pericardium. And the one that's stuck right on it would be visceral pericardium with a lot of fat mixed in it. You know, most times on a human heart, you can have almost an inch of fat around the heart. That's how much fat there is. This is all fat. See this how smooth and shiny? That's all fat. You'd have to pierce through quite a bit before you even touching the heart. So that's how far I pierced in before even poking the heart. That's all fat. So this right here then would be a sulcus. Sulcus is like a little groove. So that would be the interventricular sulcus, which is on the anterior. And that's going to separate your two ventricles. So now that I've drawn that sulcus in here and I know it's here, this is where your widow artery is. Okay, your ventral descending coronary artery, which would run in here. When this one blows out or gets clogged, you kill off all the left ventricle. So the person usually dies. And this is known as the widow artery. That's the nasty one when it occludes. So this would be my left ventricle, and this over here is my right ventricle. Simple as that. Okay? This is the apex, the point of the heart. This is the apex. You're going to have plenty of time to see. You can't see. Okay? So now we look here from the outside. So if I come up above my right ventricle, going more posterior would be what? Your right auricle and atria. The auricle is the outside surface, the atria is the inside. You can use the terms interchangeable, I don't care. All right? Come up from the left, here's your left. So there's your four chambers of the heart. Right? You have two atria, two ventricles. That all stays the same. It's either going to be left or right. So there's not a lot of names to learn. So right here, from the outside, we can see this is our pulmonary trunk, which becomes the pulmonary arteries and beats to the blood to the lungs. In the back here is the aortic arch that I'm holding this by. This is the arch right here. That's the arch. That's the aortic arch. Right here. And this first major branch pushing off the aortic arch, I'm sticking the probe down inside, is the brachiocephalic. Okay, it's going to feed the arm and head. That's what brachiocephalic means. Right behind it, the skinnier one that I'm sticking the probe in, right here would be the superior vena cava. So they go in order. 1, 2, 3. So you go pulmonary, trunk, aortic arch, superior vena cava. Because the inferior is going to come up from underneath, and a lot of them is chopped off. This could be residuals of it right here. You might just have a hole to get into, but it's very hard to get inside the vein at this point, as it is the superior. Okay, where are the vena cava going to drain into? What auricle? Left or right?
Right.
The right, because they're returning blood from the body back to the heart, okay? So then what's this thing right here that I'm holding it up by? Ligamentum arteriosum, which once was, which you'll learn tomorrow, ductus arteriosus, which is a fetal structure. Which at one time, that was open connecting these two vessels together, because in the fetus, does the fetus need its lungs? No. Don't need its lungs. So we don't want to waste blood going into the lungs. So that's why you have this. So this is the ligamentum arteriosum. So that's pretty much what you have to know from the outside of the heart. Okay. The hearts are cut mostly on a spiral. I do get some that next time they'll be out that are cut front on a true coronal cut. But these are spiral cuts. And the reason why we spiral cut them, it makes it a little easier to see what we want to see internally on these hearts. So it's the same thing. We rotate this heart the right way again. We can see our septum here, so we know right here is going to be our pulmonary trunk. And this one's cut so short, you cut before they cut out where the ligamentum arteriosum would be in it. But if we take this then, so we're here, okay, so I got the heart the way we'd want it. And I'm going to spiral this open. And what I'm opening up on it is I'm tearing open totally the right side of the heart. So you're getting into the right ventricle and the right atria. So there's the right atria all opened up. Okay, so if you spiral this thing open enough and see, when you open it all the way up, you see there's a hole in there. See that hole? This one right here, where I'm sticking the probe. The hole right there, there's a hole. Everybody see the hole? Everybody can see there's a hole. In other words, when you open up this right ventricle and you rip it all the way around to the posterior, and the atria on top is going to open with it, you're going to get a space. And that little hole is what they call the coronary sinus. That's where the coronary veins deliver the blood back to this atria, the sinus. Most of them, if you just come up, because the easiest guide to use to find it, say my superior vena cava. As soon as you come into the superior vena cava, it's right below it where it's entering. And if you come up just a teeny bit from it, immediately, you get onto an area that's kind of soft. See, like soft and round right here? That's the fossa ovalis, which once was the foramen ovale. At one time, when this is in the fetal heart, there's a hole between the two atria, because you don't need to push blood to your ventricle. So blood would come in right into your right atria, go right over to your left atria, down to the left ventricle and out to get it in circulation. Okay? In some cases, blood will go into the right ventricle, and if that happened, when it goes into the pulmonary trunk, it would cross through the ductus arteriosus right into the aorta. So you have two bypass routes against the lungs inside the heart. Okay? So that's why these structures are still here, that you can see it. Now